Welcome to the deep dive. Today we're getting into a specific health topic for dogs and cats, one that might not be top of mind usually, but it's really important. Ceruminous gland adenocarcinoma. Basically, we're doing a deep exploration of this particular ear cancer. We'll look at what it is, how you spot it, treatments, and the outlook.
Right.
So we've got some good sources here, and our aim is really just to break down the key info and make it understandable for you.
And it's interesting because while overall it's not super common, if you look just at tumors inside the ear canal, this one is actually the most frequent malignant type we see.
Ah, okay.
In both dogs and cats. So yeah, it's sort of the most common of the rare tumors in that specific spot.
Okay, right. So for anyone listening thinking, ceruminous gland adenocarcinoma, that's a mouthful. Let's start right at the beginning. What defines this cancer?
Sure. So it originates in the ceruminous glands. Think of them as like modified sweat glands that line the external ear canal. The main thing about this cancer, the characteristic feature, is that it tends to be pretty aggressive right where it starts. Locally invasive, we call it.
Invades the nearby tissues.
Exactly. Now, the sort of upside, if you can call it that, is that it doesn't typically spread far and wide very quickly. The metastasis rate is generally low.
Right. So the main problem is contained more or less to the ear area itself. That helps frame it. Now, who gets this? Are there like a particular breeds or types of pets that are more susceptible? Or maybe certain ages?
Yeah, there are some patterns. It's generally seen as uncommon overall, but we do know that Cocker Spaniels seem to have a higher predisposition.
Oh, interesting.
So that's one breed to maybe be extra watchful with about ear health. And age-wise, it tends to show up in older animals.
Okay.
The average is around 10 years old in dogs, maybe 11 in cats.
And males versus females? Any difference?
Doesn't seem to be, no. We don't really see a sex predilection in the data.
Good to know. Especially that Cocker Spaniel point. So if you have one, keeping a close eye on those ears seems wise.
Definitely.
How would an owner, or even a vet initially, tell this apart from just, a stubborn ear infection? What are the signs?
Yeah, and that's the tricky part, honestly, because the early signs can look exactly like a common otitis externa.
Okay.
You'll see things like discharge, maybe a bad smell. The pet might be scratching or shaking their head. There's inflammation.
All the usual suspects for an ear infection.
Pretty much. But there is one key visual clue that should really make you pause.
And what's that?
It's the presence of a mass, or sometimes multiple masses, inside the ear canal. Typically, they look kind of pale pink.
Yeah.
And they tend to be fragile, easily ulcerated, and they might bleed if you touch them or even spontaneously.
Ah, okay. That sounds quite different.
Yeah.
A pale pink, fragile, bleeding nodule. That's not your standard infection gunk.
Exactly. So while the initial symptoms might seem routine, seeing that kind of growth is a big warning sign.
Right. And what if it's missed early on? What does it look like as it progresses?
Well, these masses can unfortunately get quite large. They can fill up the whole ear canal.
Wow.
And eventually, they might even invade through the canal wall into the surrounding tissues. You might also notice the nearby lymph nodes, the ones under the jaw or near the ear, become enlarged.
Okay.
And depending on how deep it goes, if it involves the middle ear structure,
Then you might see other things.
yeah, then you can start seeing neurological signs.
Yeah.
Things like balance issues, a head tilt, what we call vestibular signs, or even Horner's syndrome.
What's Horner's syndrome involve?
That affects the eye on the same side. You might see a droopy eyelid, the pupil might be smaller, the third eyelid might be more prominent. It's due to nerve involvement.
Right. And I imagine pain becomes more obvious too.
Definitely. Pain and discomfort. Sometimes owners notice their pet is reluctant to open their mouth fully, maybe because it stretches that area.
Those later signs really do paint a more severe picture, make spotting those early visual clues even more critical.
Absolutely. Early detection is key, but it's challenging.
So moving on to potential causes. We mentioned chronic inflammation earlier. Is that like the main theory? What leads to this?
The evidence suggests there's likely a link, yes, between long-standing chronic inflammation in the ear canal.
Like from recurrent infection?
Yeah, or allergies causing chronic otitis. And this abnormal growth pattern in the ceruminous glands themselves, something called hyperplasia or dysplasia.
So the glands change first.
It seems that way, that persistent irritation and those cellular changes might, over time, create an environment where a tumor is more likely to develop.
Oh.
But it's important to stress, we can't say definitively that, every chronic ear infection will lead to this cancer. It's more of a risk factor.
A potential pathway. Got it.
Yeah,
So it does suggest managing chronic ear problems is probably a good preventative idea anyway?
always a good idea, yes.
Now, let's say a vet does suspect this. They see that mass, the signs are concerning. What's the diagnostic process? How do you confirm it and rule out other things?
Right, so you need a systematic approach. First, you think about the differentials. What else could this be?
Like what?
Well, severe chronic infections, certainly. Benign growths like adenomas, which are non-cancerous versions from the same glands. Inflammatory polyps, especially in cats. And then other types of ear tumors, too.
Other cancers.
Yeah, things like squamous cell carcinoma, basal cell tumors, mast cell tumors, though they are less common in the canal itself compared to this one.
Okay, so lots to rule out. What tests are typically run?
Your standard blood work and your analysis are usually pretty normal. They don't typically point towards this specific cancer.
Okay.
But you'll definitely want to do cytology, looking at cells from an ear swab under the microscope, and bacterial culture and sensitivity testing on any discharge.
Like the culture.
Mainly to identify and treat any secondary infection that's going on concurrently, which is common. It doesn't diagnose the cancer, but it helps manage the whole picture.
Makes sense. And then I assume imaging comes into play to see what's happening deeper down.
Absolutely crucial. Simple skull x-rays can give a basic look at the bony structures around the middle ear, the tympanic bulla.
Okay.
We also usually recommend chest x-rays. Even though metastasis is less common, we need to check the lungs just in case.
Standard procedure for cancer staging.
Exactly. But really, for getting the best detail on the tumor itself, how big it is, has it invaded bone, are lymph nodes involved, CT or MRI, are much, much better.
More detailed picture.
Way more detailed and really invaluable, especially if you're planning surgery or radiation therapy. You need to know the extent of the problem.
Okay, so imaging maps it out.
Yeah.
But how do you get that definitive, yes, this is Ceruminous gland adenocarcinoma?
The only way to be absolutely sure is with a biopsy. You need to take a tissue sample from the mass.
And look at it under the microscope.
Precisely. That's histopathology. The pathologist looks for the characteristic features, the glandular patterns, signs of malignancy like abnormal cells, invasion into surrounding tissues. We might also take samples from any enlarged regional lymph nodes using a needle aspirate to see if cancer cells have spread there.
So it's a multi-step process. Rule out infections, image to see the scope, and then biopsy for the final confirmation.
That's the approach, yeah.
All right, so once you have that confirmed diagnosis, what are the treatment options on the table?
The preferred approach, the one generally associated with the best outcomes, is a major surgery. It's called total ear canal ablation and lateral bulla osteotomy.
TECA.
Exactly. It's quite extensive.
What does it involve, basically?
Essentially, it means removing the entire vertical and horizontal ear canal right down to the middle ear, and then opening up and cleaning out part of that bony middle ear cavity, the bulla.
Wow, that sounds like a lot. Why such an aggressive surgery compared to, say, just removing the visible tumor mass?
Because, as we said, this tumor is really good at microscopic invasion. Just taking out the lump you can see often leaves cancerous cells behind in the deeper parts of the canal or surrounding tissue.
And those cells can then regrow.
Exactly. So the TECA aims for what we call wider margins, removing the entire structure where those cells are likely to be hiding. It dramatically reduces the chance of local recurrence.
Okay, that makes sense why it's preferred then. Are there other options if surgery isn't possible, or maybe in addition to surgery?
Yes. Radiation therapy is another important tool.
How is that used?
It can be used in a few ways. Sometimes if a tumor is really huge and maybe not easily removable surgically at first, radiation might be used to shrink it or slow it down. That's more palliative.
Okay.
Or it can be used after surgery, especially if the surgeon suspects they couldn't get absolutely all the cancer cells out, what we call incomplete margins.
To clean up any remaining cells.
Right. In that case, radiation can be given with curative intent, aiming to kill off any residual microscopic disease.
What about things like chemotherapy? Does that fit in?
It's less commonly used as a primary treatment for this specific cancer. It hasn't been studied as extensively compared to its use in other cancers, but it might be considered sometimes, maybe if there's evidence of metastasis or in combination with other treatments in certain situations. But surgery and or radiation are really the mainstays.
And supportive care, I imagine.
Yeah.
Pain relief.
Oh, absolutely critical. Managing pain is huge, often with NSAIDs or other analgesics, and antibiotics if there's infection, based on those culture results we mentioned earlier.
So it sounds like TECA surgery is the heavy hitter, potentially followed by radiation if needed.
That's generally the most effective strategy for long-term control, yes.
Okay, so after a pet goes through treatment, especially that big TECA surgery, what's the follow-up like? What should owners expect?
Close monitoring is really important. Usually this involves regular physical exams by the vet,
How regular?
typically every 3 to 4 months or so, especially during the first year after treatment. We also recommend repeating chest x-rays periodically during that time.
Still watching for any potential spread, even if it's less common.
Right, just to be safe. And in some cases, depending on the specifics, the vet might suggest follow-up CT or MRI scans down the line to get a very detailed look at the surgical site and make sure there's no sign of recurrence locally.
Okay, and are there potential complications from the TECA surgery itself that owners should be aware of?
Yes, there are some known potential side effects related to the nerves in that area.
Like what?
The two most common are Horner's syndrome, which we mentioned earlier, the eye changes and facial muscle effects,
Right.
and also facial nerve paralysis. This can cause drooping of the lip and ear on that side, maybe some difficulty blinking.
Are those usually permanent?
They can be permanent, but often they are temporary and resolve over weeks to months. Facial paralysis seems to be a bit more common in cats than dogs after this surgery.
Good to know those possibilities. Now, the big question, what's the overall prognosis? What's the outlook for pets diagnosed with this?
It really depends heavily on a couple of things. How advanced the tumor is at diagnosis, and crucially, which treatment is chosen. There's a pretty stark difference in survival times reported in studies.
Can you give us some numbers?
Sure. So if a less aggressive surgery is done, like just a lateral ear resection, which only removes the outer part of the canal,
Right.
the median survival time reported is often around 10 months or so for both dogs and cats.
Okay, less than a year on average.
Yeah. But if the pet undergoes the full TECA surgery,
The big one.
the big one, yeah, the median survival times jump significantly. We're talking greater than 3 years on average for both dogs and cats.
Wow, that's a huge difference, more than 3 times longer.
It's a very significant difference, yes. And studies looking at radiation therapy, although maybe with fewer numbers, have also reported median survival times over 3 years.
So the more aggressive local treatment really pays off in terms of longevity.
It certainly seems to. There are also factors that tend to suggest a poorer outcome.
Like what?
Things like evidence of the tumor having already spread extensively when diagnosed, if the pet already has neurological signs before treatment starts, and, as the numbers suggest, opting for less aggressive treatments, like that lateral resection alone.
Those survival stats are really striking. They make a powerful case for considering that TECA surgery if possible.
They really do. It gives owners a clearer picture of what the treatment choices might mean for their pet's future.
Okay, so let's just quickly recap the main points from this deep dive. Ceruminous gland adenocarcinoma. It's the #1 malignant ear canal tumor in dogs and cats.
Right.
It can look a lot like a regular ear infection at first, which is tricky. But that key visual sign, the pale pink fragile mass, is a major red flag.
Definitely.
Diagnosis takes a careful workup, including good imaging like CT or MRI, and ultimately a biopsy. And treatment-wise, that aggressive TECA surgery offers a significantly better long-term prognosis, potentially extending survival from months to years.
That sums it up well. Aggressive local control is key.
It really makes you think, though, given how easily this serious cancer can initially be mistaken for something common, what can pet owners listening do proactively? How can you make sure you don't miss something like this, hidden behind what looks like a simple ear infection?
That's a great question. It highlights the importance of thorough vet checks for any persistent ear issue. And perhaps it raises other questions too, like, what triggers these glandular changes in the first place? Is there anything more we can learn about prevention down the road?
Absolutely. Definitely food for thought for all of us who care for animals.